Hello everyone, I am here and Dr. Sreekanta Swamy, Head of Neurology at Aster Hospital, JP Nagar, Bangalore. I am here to give you some information regarding the most disabling neurological degenerative condition that is called Parkinson's disease. Now, many people would not have heard the name the disease carries, but it is true that it is becoming more and more rampant in the population. At least about 10 million people all over the world are suffering from this disease called Parkinson's disease. It is a brain disorder which is a progressive disease. It is called a neurodegenerative disease, meaning there is no going back. The things will not improve in this condition. In fact, the things will go on becoming worsening day by day. So, as the number of aged populations are increasing all over the world, we see more and more age related neurodegenerative conditions, and it is the second most disabling condition after the Alzheimer's disease as far as the brain degenerative neurological conditions are concerned. And it affects most of the time after 60 years of age, and every 10 years the incidence doubles in fact. So, the more you are getting older, the more chances that you might get this problem. Even though it occurs in an younger age before 50 years also, it is almost about 10 to 15% only. Very rarely, like about 5% to 10% of the people have familial or hereditary transmission of this disease from the parents to first relatives. And this important to know this disease is because it is a progressive condition, means it day by day it increases. It makes the person disabled from beginning till the end. So, it is there with the person till his death. So, that is the importance of knowing this problem. So, once you know that, you are mentally prepared to handle the person who suffers from this disease in the future. Now, the economical burden of this disease is too much, both on the family as well as on the society in which they live. So, the most important thing I would like to you to understand is that the disease may go unnoticed for 1 to 2 years because it starts so slowly. Many doctors may not be able to identify it in the beginning at all. Usually, the symptoms or the trouble starts when there is more than 50% of the damage in the brain occurs. The brain damage occurs in a particular area called basal ganglion or striatal area, wherein there is a hormone called dopamine, which is required for all our movements, emotions, etc., will produce less and less day by day. When it reaches almost about 50% or less, that is when the trouble starts with the patient. So, most commonly, most patients become slow in all their activities over time. They start with the hand shivering on one side. Over time, it may spread to the opposite side. They become slow in their activities. They become slow in their thinking. Over time, as the disease progresses, they lose balances. They may frequently fall, and their speech becomes low volume, and swallowing difficulties and forgetfulness. These things may become more and more day by day. And there is no, as of now, there is no cure in the world for this disease, and no investigations exactly tell 100% it is Parkinson's disease, but they all can suggest. Now, there are people who are specialized in this disease called movement disorder specialist who can tackle these things better, but a general doctor may find it difficult to handle. There are both medical treatment and surgical treatment available for this disease, and Parkinson's disease responds well to the commonly available medicine like Syndopa or Levodopa, and there are other medications also available. And depending on what symptom is more, we choose the medication. Depending on the age, depending on the side effect, we choose the medicine. When somebody does not respond to the medication, then we have what is called deep brain stimulation surgery also. And for this patient, the good candidates to select for the surgery is patients who respond well to the levodopa treatment, and patients whose memory or cognition is preserved, and patients who have tremor or shaking of the hand as a predominant symptom. So, you can opt for both medical and surgical treatment. In the beginning, first 1-2 years medicines work very well. After that, the medicine effect starts to come down with lot of side effects. So, it becomes more and more progressively difficult for the treating doctor to tackle the patient side effect as well as balance his symptoms. For the family, they have to be mentally prepared. Sometimes as it progresses, it will worsen. So, the person may depend on the family members. So, how to prevent it? Unfortunately, there is no preventive measure that are available, but it is said that regular physical activity, keeping somebody active, and diet, which is balanced diet, these things will usually prolong the duration of the illness or slow down the disease. But as of now, no medications will delay the progression. It will progress, but by exercises, diet, etc., and these people can postpone the progression. And depression is very common in these patients, mood disorders are very common, and sleep disorders are also common. Before the disease actually starts, somebody may develop a lot of constipation for many years. They may have difficulty to appreciate the smell. These things will precede or start before the actual symptom starts. So, if you see anybody becoming slow in their walking, or they bend down walking, and their voice becomes low, monotonous, and they don't express emotions when you talk to them, probably you have to suspect whether patient has got Parkinson disease and consult a specialist like neurologist or movement disorder specialist. And hopefully, if you consult them, they may identify and initiate the treatment if required. Some people initiate the treatment in the beginning, some people wait for some time, but now of late the opinion is that you better initiate the treatment in the beginning, so that give a good quality of life to the patients. So, important thing in the Parkinson disease is managing their symptoms, so that they have a good quality life without suffering. And the aches and pains and depressive features are all extremely common in this disease. So, sometimes we don't, neurologists may require support from the psychiatrist to handle their psychiatry or behavioral problem. Sometimes they may require rehabilitation specialist help to handle these patients. So, that is how it goes. So, I hope I have made some points clearer to you about this common disease, Parkinson disease. April 11th every year is observed as a World Parkinson's Day, even though it is about more than 200 years now after identification of this disease. Still, we have not found a cure. And of course, medications have been better and better every year, but we have no cure, and there is no specific medicines to delay the progression. So, hence on the World Parkinson's Day, my message to you people is, if you observe any of your family members or neighbors or friends who become slow, whose hands are shaking for so many reasons, and who tend to bend forward and walk, who does not show much expression when he speaks, and who walks slowly and tries to lose his balance frequently, you are probably right in suspecting whether he has a problem called a Parkinson disease, and you should seek medical help. Thank you very much.